1. Introduction of substance abuse issue in Indian youths. As the drug epidemic seeps into the country's social and cultural aspects, drug usage naturally spreads to our younger generation. 15-24-year-olds are India's future, making about one-fifth of the population. Our nation's kids will shape its moral, political, and social views. India's large population is a heavy load. Drunkenness doesn't help. Our nation's youth are responsible. While India's future is in their hands, the drug crisis rages. Just like a footballer's attitude and deeds might affect his team and cause them to lose, illicit substances can hinder India's future. Substance abuse includes the destructive use of alcohol and illegal drugs. Psychoactive drug usage produces health and social difficulties for users and their family and communities. Alcohol, opiates, cocaine, amphetamines, hallucinogens, prescription, and OTC drugs are abused. Psychoactive chemicals alter mental processes when taken orally. Psychoactive drug usage threatens families, communities, and nations' health, social, and economic well-being. Alcohol use disorders are more common than drug use disorders globally. Males have higher alcohol and drug use issues than females. According to the World Health Organization Report 2002, WHO, 8.9% of the total illness burden is attributed to psychoactive substance use, tobacco 4.1%, alcohol 4%, and illegal drugs 0.8%. 2 billion people drink alcohol, 1.3 billion smoke, and 185 million use drugs. WHO 2002. Different age groups are affected differently by these three drugs. Illicit drug usage causes early death, alcohol, 65%, before 60, and cigarettes, 70%, after 60. In Europe and Southeast Asia, cigarette usage is the biggest burden. In Africa, the Americas, and Western Pacific, it's alcohol. 3.5% to 5.7% of the world's 15-64-year-old population used cannabis, amphetamines, cocaine, opioids, and non-prescribed psychoactive prescription drugs. WHO 2008. Cannabis is the most commonly used substance globally, 129 to 190 million, followed by amphetamines, cocaine, and opiates. People who inject drugs risk HIV, hepatitis B, and hepatitis C. Injecting drug users account for 10% of HIV infections, or 13 million persons globally. Globally, 67% of injectors have hepatitis C. Indian adults consume opioids. Heroin and prescription opioids are opioids, such as buprenorphine, pentazocine and dextropropoxyphene. In the Northeast, heroin and dextropropoxyphene are the most popular opioids. In Delhi, Mumbai, Chennai, and Kolkata, it's impure heroin, smack, and buprenorphine. Karnataka, Andhra Pradesh, and Chhattisgarh inject the most pentazocine. Injectors utilize buprenorphine in Punjab and Haryana. According to a research, 7.2% of adults in India have HIV. HIV prevalence among adults is 21% in Punjab, 18% in Delhi, and 12% in Manipur and Mizoram. Psychoactive drugs impair driving and increase accident risk. Individuals, families, and society can prevent health and social problems connected with tobacco, alcohol, and illicit drugs by using public health measures. 2. Impact of substance abuse in Indian youth. Drug addiction is a significant and disastrous problem that has trapped the young generation of our country. Most youths between the ages of 17 and 20 are addicted to unethical substance usage or drug addiction, and they are mostly college and school-aged kids. Even poor children abuse/addict to drugs. According to International Journal for Current Research, substance and illicit drug misuse is a global challenge in the 21st century. The United Nations Office on Drugs and Crime, UNODC, estimates that 7% of the global population aged 15 to 64 uses illicit drugs, with developing and developed countries suffering the most from juvenile drug use. Illicit drug abusers may have a biological predisposition to drug addiction, psychological features that represent a lack of social bonding, low family status, family relations, parental care, ignored emotional and psychiatric disorders, stress, and other difficulties among the youth in the globe and in India. In the social context, drug is a phrase of habit-forming substance which directly affect upon the human body. According to Indian National Bar Association viewpoint, the educational system with a competitive and a non-flexible nature has an impact where youths and students opt for fighting this non-flexibility with a state of mind which, if achieved naturally, has a good impact on them, but if achieved by harming a self, destroys everything. Millions of young people who compete in life find a way to relieve tension that compromises their long-term ambitions. Choosing medicines and antidepressants to battle stress stains not just their identity but also their hard work. Parents' demands at home, insulting treatment in schools, colleges, jobs, among friends and relatives lead to drug misuse among teens who can't cope. Workplace stress and enmities with co-workers lead to youth deviation, which has severe and harmful implications. The present scenario of the Indian society is completely different from the past. In urban areas, families are becoming nuclear, both parents are working, and they are unable to give their kids quality time. Moral values have also lost importance in families, and elders are being neglected. Children often look outside their homes for someone to share and express themselves, and this sometimes leads to crime. In such situations, teens believe drugs make them forget their stress and feel free. They prefer narcotic numbness over practical life strain. In his article Drug Addiction and Youth in India, journalist Vikas writes, parents, elders, and friends should be careful and alert when they observe the following symptoms in any of their known youngster/child: carelessness, reduced interest in studies or work, reduced interaction/communication with others, loss of interest in physical or recreational activities at school/college/workplace/home, constant weariness, anger, fights, disagreements, feels like changing into a negative person, engage in unethical and criminal actions like theft, accidents, sudden loss of interest, appetite, and weight, sudden sweating and increased sleeping time. International Day Against Drug Abuse and Illicit Trafficking is commemorated on June 26 to raise awareness about drug abuse and addiction. With this global observance, individuals, communities, and organizations aspire to increase awareness about substance misuse and strengthen action and collaboration to achieve a drug-free society. Substance addiction among adolescents is rising alarmingly in India due to shifting cultural values, severe rivalry in education and work, growing economic pressure on families, and weakening supportive relationships for adolescents in this transitional period. Adolescents initially explore with glues, tobacco, hashish, and alcohol. Street children, child laborers, and teens with a family history of drug misuse and mental and behavioral problems are the most at-risk adolescents. According to a National Commission for Protection of Child Rights survey, adolescents most commonly abuse tobacco, alcohol, inhalants, and cannabis. The average age of onset of tobacco use was 12 years, and 46% of slum-living adolescents began using smokeless tobacco, alcohol, and cannabis as children. 1. With easy availability to smokeless tobacco, Delhi slum studies suggest initiation as young as 6 years old. 2. Data from Project Uday, a Population Council, Bill and Melinda Gates Foundation, and Packard Foundation program, demonstrates that adolescent boys take drugs 15 to 19 years. The Uday study on tobacco, alcohol, and drug use found that 20% of teenage boys aged 15 to 19 in Bihar and 22% in Uttar Pradesh, UP, use tobacco and tobacco products. 4 to 5% of younger boys, 10 to 14 years, also use tobacco products. In Bihar and UP, rural boys consume more than urban boys. 21% versus 17%, respectively. 1% of 15-19-year-old boys in Bihar end up reported using heroin, brown sugar, cocaine, ganja, charas, and bhang. 3. In Bihar, 8% of older males consume alcohol, while only 2% of younger boys do. Married older girls, 15 to 19, smoked more tobacco than younger girls, 10 to 14, and unmarried older girls, 2% in each state. Unmarried girls had a 0.1% drug misuse rate, while married older, 15 to 19 years, and younger, 10 to 14 years, girls and boys never used drugs. Substance misuse has the greatest impact on the mental health of teenagers, who may develop substance use disorder, leading to mood disorders, sadness, anxiety, thought disorders like schizophrenia, and personality disorders including antisocial tendencies. Nicotine alters the way synapses are generated, damaging the areas of the brain that control attention and learning. Brain development continues until age 25, and during adolescence, the brain is vulnerable to tobacco smoke's detrimental effects. Substance addiction causes quarrels with friends, family, and relatives, accidents, and severe health conditions. Some lose their jobs or drop out of school owing to poor performance. One study found that 3% of teens who took drugs were also involved in criminal behaviors such as petty theft, burglary, and vandalism. 4. Substance abuse intervention programs should address both prevention and treatment. Programs should prevent drug initiation. Interventions must target younger age groups, before the typical start age. Effective implementation of substance abuse legislation like the Tobacco Control Act can reduce teen access. Parents of at-risk youth and adolescents should also contribute to preventative programs. Such therapies should focus on psychosocial development rather than only preventing target drug use to improve a person's development. Regular parental monitoring, supervision, and conversation helps avoid substance usage. Parent training, family skill building, and family therapy help reduce drug use. 40% of India's under 18 population is at danger for substance misuse. West Bengal, Andhra Pradesh, Uttar Pradesh, and Haryana youth use gateway drugs. 55,000 low-income children start smoking per year. Over 70% of adult smokers report starting daily smoking before age 18. Substance misuse hinders the survival, protection, growth, and development of healthy children, which improves quality of life. Protecting children from substance misuse is vital for creating a world suitable for children and achieving the Millennium Development Goals. 3. Some facts about substance abuse. 2 million opiate users, 8.7 million cannabis users, and 62.5 million alcohol users, of whom 17 to 20% are dependent, according to a NODC report, CTA, 2006. WHO says 25 to 90% of children and teens abuse drugs. WHO, 1997. According to the 2001 census, India has 449 million children under 18 and 35 million need care and protection. Many of these youngsters suffer from apathy, alienation, deprivation, abysmal poverty, exploitation, and abuse. Substance misuse is one of their biggest problems. Substance addiction affects tribal, rural, and urban Indian youngsters. There are certain differences, such as the higher prevalence rate among street and slum children compared to school-aged children. Studies reveal that substance misuse is more common among boys than girls and urban youth than rural children. Most substance abusers were adolescents, a vital time for trying new things. Marginalized youngsters begin using drugs earlier than school-aged children. Benegal et al. 1998 found that street children start using cigarettes around 10 to 11 years old and then progress to inhalants. By age 13, adolescents stop using inhalants and experiment with alcohol and illegal narcotics like cannabis, brown sugar, etc. The Ashadeep Integrated Center for Addicts surveyed Kolkata's children on substance misuse in 2002. 64% of patients at that addiction center were introduced to drugs by age 15. 12.3% of drug users in Kolkata and suburbs are under 20. 21%, 4%, and 0.1% of alcohol, cannabis, and brown sugar consumers were under age 18. Micro-studies have proliferated in the previous 15 years. Media have also covered this. Children are major victims of India's substance misuse epidemic, according to these studies. Substance addiction affects tribal, rural, and urban Indian youngsters. There are certain differences, such as the higher prevalence rate among street and slum children compared to school-aged children. Studies reveal that substance misuse is more common among boys than girls and urban youth than rural children. Most substance abusers were adolescents, a vital time for trying new things. Marginalized youngsters begin using drugs earlier than school-aged children. Benegal et al. 1998 found that street children start using cigarettes around 10 to 11 years old and then progress to inhalants. By age 13, adolescents stop using inhalants and experiment with alcohol and illegal narcotics like cannabis, brown sugar, etc. Studies demonstrate that school-aged children use predominantly tobacco and alcohol, whereas out-of-school youngsters, especially street, slum, and child laborers, experiment with licit and illicit drugs. Ahmad et al. 2007 found that substance use increases with age. Most children use tobacco, alcohol, and inhalants, according to these research. Alcohol, tobacco, and inhalants are supposedly gateway drugs that lead to harsher narcotics. Myers, Petty, 2008. Street children and migrant youngsters start with cigarettes, inhalants, alcohol, and stronger drugs like ganja, charas, heroin, opiates, etc. Benegal v. et al. 1998. Malhotra c. 2007. Chetna, 2007. Children easily get gateway medicines. They're not unlawful and there's little acknowledgement that they induce addiction. Misconception: something is only a drug if it's illegal. Substance abuse hinders children's survival, protection, growth, and healthy development. The body builds tolerance to these substances with repeated use. Tolerance is when a drug user needs more and more to get high. Smaller doses that once worked no longer do, thus the user must take more. Increased intake causes psychological and physical dependence. Psychological dependence is characterized by emotional and mental obsession with drug effects and yearning. The user becomes psychologically dependent on the drug. The user's body becomes entirely dependent on the substance when physical dependence develops. With long-term use, the body gets reliant on the drug to function normally. Ranganathan S. et al. 2008. Chronic addiction develops when physical and psychological dependency build. Addiction is the only disease whose sufferer doesn't comprehend the problem's severity. The stigma of drug use, guilt and shame from inappropriate use, and lack of information about drug effects on health and behavior all lead to denial of addiction. Substance misuse, especially among vulnerable youngsters, can cause a high-risk lifestyle. According to Benegal et al. 1998 and Tiwari P. 2007, these children engage in illicit behaviors such as gambling, drug peddling, pickpocketing, theft, fighting, rape, and self-directed aggression by slashing themselves with sharp items when inebriated. Some kids reported serious depression and suicide attempts. Benegal's study found that youngsters were pushed, paid, or offered drugs for sex. Many street youngsters and commercial sex workers abused drugs or alcohol. Children are exploited for money, narcotics, shelter, and sexual favors. Substance-abusing children are prone to delinquency and antisocial conduct. Under the influence of drugs, they can easily contract HIV/AIDS and other STDs. According to studies, youngsters consume 6 types of substances. A. Stimulants speed up the CNS. This includes smoked and smokeless tobacco. B. Volatile solvents, cheapest narcotics for street kids. Correction fluid, paint, thinners, gasoline, and glue are overused. Street children use correction fluid, which contains toluene. C. Depressants slow central nervous system function. This category includes all alcohol. Children usually drink brewed liquor, beer, etc. Cannabis medications are manufactured from cannabis sativa. Mind-altering herb, bhang, charas, and ganja are included. Illegal drugs. Mafias utilize street and slum youngsters to peddle drugs. Many street kids use these narcotics. Narco means to deaden or benumb. Narcotic products numb pain. Opiates include natural, opium, morphine, codeine, and semi-synthetic, heroin, narcotics. Synthetic opioids, e.g. buprenorphine. Street kids are addicted to heroin, opiates, and codeine. Prescriptions. Due to simple availability, children buy and consume pharmaceuticals. Children overuse cough syrups, painkillers, and sleeping medications. Some myths about substance abuse and addiction. Myth: addiction to substances can only occur in particular types of people. The addiction to drugs is a sickness, and as such, it can strike anyone at any time. However, due to the fact that brain development continues well into adulthood and adolescence, the likelihood of substance misuse being a problem in adolescents and young adults, ages 15 to 25, is higher than it is in other age groups. Teenagers and young adults are more likely to take risks, which could make them more vulnerable to the influence of their peers and other factors. In addition, the ability to make mature decisions is typically lower among adolescents and young adults than it is among adults. This misconception is especially perilous because it gives people who come from families with a history of substance abuse or addiction the false impression that they are safe from developing these problems themselves. But only because you were raised in a household with a parent or other relative who struggles with substance abuse does not guarantee that you will also develop a dependency on drugs. Having a family member who is addicted to drugs or alcohol does not guarantee that you will automatically become addicted to drugs yourself. Nevertheless, it does raise the likelihood that you may develop an addiction in the future. Myth: a person is not really addicted to drugs yet even if they have only used that one drug once. The brain can become dependent on substances like alcohol or narcotics, which is the first step in the development of addiction. These drugs change the way the brain functions by increasing the amount of dopamine that is produced in the region of the brain that is responsible for our feelings of pleasure. Causes of substance abuse in Indian youth. Some of the risk factors that can affect a youngster for a lifetime of issues including substance abuse and other disorders have their presence during various stages of a person's developmental journey. Numerous risk factors are connected to one another and frequently occur in clusters. The numerous factors that pose a danger are as follows. Prenatal period. Both smoking and drinking alcohol during pregnancy can have negative effects on the development of the fetus, leading to abnormalities in the child's growth and physical development as well as cognitive deficiencies. Early childhood and childhood. During the first year of a child's existence, insecure attachment can cause the youngster to be hostile or withdrawn, as well as have problems socializing with other children or adults. Aggression that is not under control in the early years of life might result in poor social skills and difficulties during the preschool years. Children can develop additional social and behavioral issues, as well as academic failure, if their classrooms do not have adequate structure in the school environment. Concurrently, they may be exposed to a larger availability of drugs, as well as drug abusers and social activities that involve drugs. Because of the difficulties they are facing, there is a greater chance that they will abuse alcohol, tobacco, and other substances. It is general knowledge that one of the contributing factors to drug misuse is the presence of abusive or neglectful parents. By utilizing drugs, an adolescent or pre-adolescent may be attempting to seek attention from a parent who is unattentive to them or to flee from a parent who is abusive to them. Continued attempts to do so through the use of drugs can be a cause of drug dependence. Additionally, parental substance abuse can have both direct and indirect effects on children by disrupting the home environment and leading to poor parenting. In homes like this, the likelihood of child abuse and neglect is significantly enhanced. Children who are exposed to second-hand smoke in the home where their parents smoke put them at increased risk for a variety of health and behavioral issues, and it also makes it more likely that those children will become smokers as adults. The most immediate risk for an exposed youth is frequently their association with other adolescents who engage in drug use. There is a correlation between mental illness and an increased propensity to take drugs. There is also a connection between a person's genes and their susceptibility to addiction. There are a lot of people who use substances because they provide joyful or desired results, but there are also a lot of people who use narcotics to numb themselves from physical or mental suffering. Certain individuals utilize these substances in order to improve their performance, remain alert, or reduce their body fat. Various ways of using substances: subcutaneously, intravenously, or intramuscularly, by injection, with a needle. Inhaled either by smoking, drawing air through the mouth or nose, or placing a bag over one's head and inhaling the contents of the bag, bagging, on the surface of a mucous membrane, such as inside the anus or vagina, the nose or under the eyelid, consumed via chewing, swallowing, or dissolving gradually in the mouth. To be rubbed directly into the skin. Diagnosing drug and substance abuse. The Alcohol, Smoking, and Substance Involvement Screening Test, ASSIST, was designed by specialists at the World Health Organization in response to the tremendous public health burden associated with the use of psychoactive substances around the world. The ASSIST can be finished in approximately 5 to 10 minutes and can be included into the routine consultation that takes place at primary healthcare facilities. The screening test checks for a variety of substances, including tobacco products, alcohol, cannabis, cocaine, amphetamine-type stimulants, ATS, sedatives and sleeping pills, benzodiazepines, hallucinogens, inhalants, opioids, and other drugs. The ASSIST interviews people to collect data on their substance use over the course of their whole lives, as well as their substance use and the accompanying difficulties over the course of the most recent 3 months. It is able to identify a wide variety of issues that are connected with the use of substances, such as acute intoxication, frequent usage, dependent or high-risk use, and injecting behavior. The ASSIST assigns a risk score to each substance based on its characteristics. The score that is obtained for each substance is then placed into one of 3 risk categories: lower, moderate, or high. This helps determine which type of intervention is the most suitable for the level of substance use, either no treatment, brief intervention, or referral to specialist assessment and treatment, respectively. In a nutshell, the ASSIST is comprised of the questions listed below. Question 1, Q1, inquires as to whether or not the individual has ever experimented with any substances over their lifetime. The frequency of drug usage in the most recent 3 months is inquired about in Q2, which provides an indicator of the substances that are most pertinent to the current state of one's health. In the most recent 3 months, Q3, inquires about the frequency with which respondents have experienced a strong desire or want to use each substance. In the most recent 3 months, Q4, inquires about the frequency of any health, social, legal, or financial problems that could be attributed to substance use. In the most recent 3 months, Q5, inquires about the frequency with which the use of each substance has interfered with role obligations. The 6th question, Q6, inquires as to whether or not anyone else has ever expressed worry over the individual's use of each substance and how recently such concern was voiced. The seventh question, Q7, inquires as to whether the respondent has ever attempted to reduce or quit using a substance but was unsuccessful, as well as the frequency with which such an experience has occurred. The eighth question, Q8, inquires as to whether or not the client has ever injected any substance, as well as how lately they have done so. Screening is an important element of sustaining prevention practice activities in healthcare settings. Its primary objective is to identify potential health issues or risk factors at an early stage, far before these things have caused major disease or other complications. Treating substance abuse. Abuse of substances requires a multifaceted approach to treatment since it can have a negative impact on so many facets of an individual's life. The individual receiving treatment for addiction must be assisted in quitting the use of drugs, developing and sustaining a lifestyle that is drug-free, and regaining the ability to function effectively in their family, on the job, and in society. Patients need to receive care over an extended period of time and on multiple occasions for them to have any chance of achieving the ultimate objective of prolonged abstinence and recovery. The following should serve as guiding principles for effective treatment. 4. Abuse of addictive substances can be treated. 5. Treatment varies widely depending not just on the substance being abused but also on the individual features of the patient. 6. It is essential that treatment be easily accessible. 7. For treatment to be successful, it is necessary to address not only the individual's substance misuse but also any accompanying medical, psychological, social, vocational, or legal issues. 8. The treatment of drug misuse that is utilized the most frequently is behavioral therapy, which may take the form of individual, family, or group counseling. 9. When paired with counseling and various other forms of behavioral therapy, medication is an essential component of treatment for a large number of individuals, such as those addicted to alcohol, nicotine, heroin, or other opioids. 10. The treatment and services plan for an individual must be evaluated on an ongoing basis and adjusted as required to ensure that it continues to fulfill the individual's evolving requirements. 11. The length of treatment that is most suitable for a particular individual is determined by the nature and severity of the patient's problems as well as their specific requirements. The process of recovering from drug addiction is typically one that takes a significant amount of time and frequently involves attending many treatment sessions. 12. Within the larger population of people who are affected by substance use disorders, there are several subgroups that often require targeted and specialized care. These subgroups include adolescents, women, pregnant women, people with medical and psychiatric comorbidities, sex workers, and individuals who are socially marginalized. 13. Drug dependence treatment services should be planned, implemented, and monitored with active participation from the target populations, as well as their families, community members, and local organizations. 14. There should be coordination between the treatment of drug dependence and the criminal justice system for people who have committed crimes linked to drugs because there is a high prevalence of drug-related crimes. Complications developed because of substance abuse. The type of drug that is misused as well as the length of time that it is taken both have a role in the damage that is produced by substance usage. The severity of the issues that arise as a result of drug misuse is also affected by the following factors. Age. The risk of harm is increased not only for younger people but also for older people who are over 50 years old. Nutritional status and living situations, inadequate quantities and quality of food, unsanitary living conditions, and a lack of access to healthcare all contribute to an increase in the severity of the issues produced by substance misuse. Condition of the individual's health before to the commencement of addiction. The damage is less severe in those whose physical condition was good previous to the onset of addiction, in comparison to people whose health was bad even before the onset of addiction. A family history of a particular medical or psychiatric problem renders the individual more sensitive to the same problems in contrast to another drug abuser who is not genetically predisposed to the disorder. This is referred to as the genetic loading factor. Complications arising from medical and mental treatment owing to substance abuse. A. Complications resulting from intoxication. Changes in mood brought on by drugs lower inhibitions and heighten unpleasant sentiments, both of which can contribute to violent behavior. Traumatic experiences or other types of physical injuries. Accidents and injuries can occur when people are driving automobiles or using machinery while under the influence of alcohol or drugs. The lack of good judgment combined with inadequate coordination can lead to serious injuries or even death. Perceptual distortions can also result in accidents. Acute reaction to being intoxicated. Comas and fatal overdoses were reported. B. Issues caused by the withdrawal process. As part of the withdrawal process, people experience physical withdrawal symptoms of varied intensities. C. Psychiatric illnesses connected with substance misuse. Psychoactive chemicals, such as cannabis, have the potential to generate psychotic disorders either while they are being used or soon after use. D. Disorders of the body's physiology that are linked to substance misuse. Dermatological complications. When multiple injections are given into the same vein, markings are left behind on the vein from each individual injection. The discoloration that runs along the vein leaves behind what are called needle tracks, which are dark lines. At the place where they inject drugs, for drug users often have tattoos and scars. Infection at the site of injection can be brought on by the use of contaminated needles. A combination of pruritus and dermatitis. Cardiovascular complications. Infection in the chambers of the heart. Blocking the circulation. Repeated injections at the same spot can lead to the formation of blood clots or air bubbles, emboli, both of which have the potential to obstruct the flow of blood through the veins. In patients with ventricular fibrillation, bleeding and unexpected death are both possible outcomes. Complications involving the lungs. Formation of an embolus. Edema of the lungs. Aspiration pneumonia. Infectious respiratory disorders such as bronchitis, TB, pneumonia, and pharyngitis are quite prevalent among those who take drugs. Complications with the liver. Hepatitis, hepatitis B, C, and D are blood-borne illnesses that can be passed on from one person to another by sharing needles. Hepatitis caused by alcohol. Fatty liver disease. Cirrhosis caused by alcoholism. Hepatic trauma. Problems that arise within the reproductive system. Abusers of illicit drugs have a significantly increased risk of contracting sexually transmitted diseases. Abuse of drugs can lead to a decrease in sexual desire as well as impotence. It is common for women who take drugs to have irregular menstrual cycles and lower ovulation rates. Physical and mental development. Children who are born to moms who abuse substances such as alcohol and drugs while they are pregnant typically have a low birth weight in addition to other difficulties in their physical and mental development. Neuromuscular complications. Cerebrovascular accidents. Dementia. Inflammation of the nerves. Bacterial meningitis. Hematopoietic complications. Disorders related to bleeding can be caused when the number of platelets in the blood is low. Depression of the bone marrow may result in a decrease in the count of both white and red blood corpuscles. Anemia is a potential health risk for alcoholics because of their poor nutritional state. Endocrine system disorders. Abuse of ganja, opiates, and alcohol all have a negative effect on testosterone levels in the body. Additionally, the risk of developing diabetes in drinkers is higher. renal function disorders. Nephropathy is caused by damage to the cells of the kidney. Gastrointestinal disorders. It is possible for peptic ulcers and gastritis, which is an inflammation of the lining of the stomach, to develop as a result of bad dietary habits as well as the effect of the drugs that are overused. Pancreatitis can be both acute and chronic. Alcoholics have a significantly increased risk of developing cancer anywhere along the gastrointestinal tract, from the mouth all the way to the anus. Cancer. Because the vast majority of alcoholics and drug addicts also consume tobacco products, the likelihood of developing cancer is very high. Preventing substance abuse in children. WHO recommends primary prevention, early intervention, treatment, care, recovery, rehabilitation, and social reintegration strategies for substance misuse, coupled with actions to minimize public health and social repercussions. Successful substance use prevention and risk reduction is necessary to improve public health in the following disorders: preventing substance-induced mental disorders and reducing injuries and violence, traffic and domestic injuries, child abuse, and gender-based, sexual, and other violence, communicable diseases like HIV, viral hepatitis, and tuberculosis, sexual and reproductive health problems, STIs, unplanned pregnancies, and complicated pregnancies, and non-communicable diseases, such as cancer, cardiovascular diseases and liver diseases. Drug misuse prevention involves take primary prevention strategies that safeguard people, especially children and young, from drug use initiation. The family is the strongest influence in safeguarding children from drug use and other dangerous behavior by providing accurate information about the hazards, fostering supportive parenting and healthy social situations, and promoting skills and chances to choose healthy lives. Happy families talk honestly and provide a healthy atmosphere for their children. Schools may instill solid values in kids regarding health and drug use by equipping them with knowledge and coping strategies. Also, target the unschooled. Street outreach is helpful. Employers can boost employee health by preventing drug misuse and helping addicts. 2. Prevent progression to serious drug use disorders by tailored therapies for at-risk individuals. 3. Public knowledge of drug impact drivings on road safety, including deaths, injuries, property damage, and harm to other road users. Law enforcement can reduce drug driving. It's crucial to enforce drug driving regulations and educate and treat drug-impaired drivers, especially repeat offenders or those with drug use problems. 4. Mass media can prevent drug misuse. They can raise awareness about drug usage and injecting drugs. National Substance Abuse Programs. The Ministries of Health and Family Welfare, MoHFW, and Social Justice and Empowerment, MSJE, are collaborating in India's Drug Addiction Program, DDAP. Under DAP, the addiction centers have been created with district hospitals and medical college psychiatry departments. AIMS is the National Drug Dependence Treatment Center, NDDTC, and a resource center for MoHFW, GOI's DAP. MoHFW, GOI has launched several health web-based programs to combat substance misuse, including Alcohol Help, Alcohol Web India.in/intervention, and M-Cessation, nhp.gov.in/quit tobacco. National AIDS Control Program, NACP, MoHFW, GOI has implemented Needle Syringe Program, Opioid Substitution Therapy. The MSJE, GOI, modified its central sector strategy for preventing drunkenness and drug misuse in 2015. The Department of Revenue, Central Government administers the Narcotic Drugs and Psychotropic Substances Act, 1985 and the Prevention of Illicit Traffic in Narcotic Drugs and Psychotropic Substances Act, 1988. Narcotics Control Bureau, Ministry of Home Affairs, GOI enforces NDPS Act. Youth leaders in drug prevention. Prevention is confusing to many young people. Some may not consider about prevention at all. Most youth, perhaps more than they realize, attempt to prevent individual and peer substance addiction. Youth can't always see prevention at work, not because it's too small to matter, but because they're a part of it. When prevention works, nothing happens, said coalition leaders. When our efforts to prevent drug addiction and usage work, none of their bad impacts and hazards develop. Coalition members and young leaders shape prevention for youth. Even a pupil who answers "no thanks, I'm good" when offered a cigarette demonstrates effective prevention. When people don't drink at a party because of a game, that's preventive. Prevention works, and strong youth leaders and their peers must share this message to promote community-level change. This philosophy motivates CHATSA's National Youth Leadership Initiative, NYLI, showing youth they're already outstanding and teaching them how to make a difference in their communities via prevention, leadership, and character building. These changes include less favorable attitudes and norms toward the substance and less usage and abuse. SBIRT is the way to talk to youth about drug use. Without teenage participation, anti-drug coalitions face an uphill battle. Youth-led, adult-guided is to be the motto. This foundation facilitates an adult-youth coalition. Adult coalition members guide youth, while young are experts on what's happening around them. They can help coalition members and leaders reach peers and build enduring change. Inspiring these skills in adolescents reduces substance use and misperceptions of harm, according to emerging studies. Misperceptions about marijuana continue to rise, especially among adolescents. Take this as a challenge if you're part of a coalition without a youth group. Beyond drug prevention, you'll witness community-level changes. If you have a youth group, be a mentor and resource. Create a broad community of engaged, motivated change agents. Because youth are today's leaders. Drug prevention. Effective prevention programs. Effective substance addiction prevention treatments can be applied in a variety of situations. Interventions can involve the family, school, and community to prevent substance misuse by focusing on environmental and community variables and policies, developmental factors, or skill development. NIDA has identified 16 important principles for prevention programs based on risk and protective variables, program type, and delivery. Evidence-based program components. Structure, content, and delivery are the essential characteristics of effective research-based programs, according to NIDA. They should be addressed when choosing a prevention program for individuals and communities. 1. Structure. Program structure includes these elements. Format. School and family-based programs have been demonstrated to prevent drug usage, while media and computer technology initiatives are showing promise. Audience. Programs are intended for a specific population, for example, at-risk girls, Latino children, to fulfill their needs. Setting. Traditional programs are meant to target an audience in its primary environment, for example, a school-based program held in a school, but it's becoming more usual for programs to be held elsewhere, for example, a family-based program held at a school, or a school-based program implemented in a youth organization, such as a boys and girls club. Multi-component or multi-type programs regularly reach their audiences in multiple contexts. 2 or more effective programs combined are more effective than 1. 2. Content. Prevention programs aim to lower risk factors and improve protective variables. Content elements include information. Drug laws, policies, and consequences can be researched. Drug education is necessary, but it's not a successful intervention without other preventative components. Training. Skill training improves behavior, for example, communication within the family, social and emotional development, academic and social competence, and dealing with peer pressure. Strategies. Some programs target structural change, for example, enforcing existing laws, such as those on alcohol or tobacco sales to minors, establishing tolerance policies, enforcing school rules or promoting norm changes, and establishing curfews. Services: school, peer, or family counseling, drug-free zones, and healthcare are program offerings. 2. Delivery. Program delivery comprises the following: program modification. Effective research-based initiatives must fit local needs, adapting a program to a certain demographic in different situations. Core elements are kept to ensure model fidelity, while updates address community demands. Implementation. Implementing a program includes sessions, procedures, and follow-up. Effective program implementation is crucial. 3. Parents. Families and influential adults play the most essential role in how youth handle alcohol, tobacco, prescription drug usage, and illegal substances. Recent studies demonstrate that parents and guardians, and other prominent individuals, who regularly have dinner with their children have children with a reduced rate of use and abuse. 2. Prevention programs can promote family/mentoring ties by teaching parenting and communication skills. 3. AE. Before high school is crucial. High school drug abuse worsens, according to data. Young people who start drinking or smoking are more likely to continue when it's harder to quit.